Hi, I'm Ali Rezaie. I'm a physician scientist at the MAST Program at Cedars-Sinai, and we're presenting this poster that we're having in the DDW. We have been using breath testing in clinical practice for decades. Now, we wanted to see what are the phenotypes associated with hydrogen sulfide, and methane when they are concomitantly measured in a real-life cohort of patients. So, for patients who were sent home kits for measuring these breath gases, we send them also the questionnaires and ask about their symptom profile. Then we received back the breath test results, and we used the cutoffs used in North American consensus for hydrogen sulfide, hydrogen, and methane. Although hydrogen sulfide levels are not described in North American consensus, the levels that we used were 2 part per million to see if that correlates with the symptoms. So we have 6,000 subjects, and of these, 3,500 returned the completed breath test, and we analyzed about 3,000 subjects who had their questionnaires completed. The average age was around 50, and the majority of the patients were females. So in terms of results, we did not see a difference between PPIs, and also bloating was the most common reason that patients were undergoing breath testing. Also, what we saw was, not surprisingly, methane was associated with constipation and also less diarrhea. And also, the higher the methane was, the severity of constipation was higher. Hydrogen sulfide was associated with diarrhea and also urgency. And also, the more the hydrogen sulfide, the higher the severity of diarrhea. So, in conclusion, bloating was the most common cause of breath testing in a real life cohort. And also, methane was associated with more constipation, and hydrogen sulfide was associated with diarrhea, pain, and urgency. Thanks for visiting us at DDW 2025 and seeing our poster.